Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com does UTI treatment at home. Work 8 suggestions. Urinary tract infections, UTIs, are a common type of bladder infection that often require antibiotic treatment. That said, mild or occasional UTIs can go away on their own. /r/n/r/n You may wish to try some remedies for UTI treatment at home, such as nutrients and probiotics, to relieve symptoms and potentially help support your body's ability to fight infection and prevent new infections. /r/n/r/n While at-home treatments may help with mild cases, you should call your healthcare provider if your symptoms persist or worsen. /r/n/r/nYuliya Shauerman Getty Imagesrnrn Some studies have shown that in healthy individuals who don't experience chronic or recurring UTIs, about 25% of those mild infections may clear without antibiotics. /r/n/r/n If your infection does clear on its own, studies have shown that most symptoms improve in the first 9 days. /r/n/r/n However, experts still typically recommend antibiotic treatment because of the possible risks of not treating a UTI. This may include the infection spreading to other body parts, like the kidneys or the bloodstream, which is rare but can be life-threatening. /r/n/r/n While some people with a mild UTI may choose to try at-home remedies, others may be at greater risk of the UTI developing into a severe infection. Experts often strongly recommend getting antibiotic treatment if you /r/n/r/n If you're unsure whether you should treat a potential UTI at home or with medical care, check with a healthcare provider to ensure you're taking the best course of action for your health. /r/n/r/n There aren't any over-the-counter, OTC, treatments that are proven to cure a UTI. However, there are some at-home strategies you may consider to help relieve symptoms and potentially help your body fight the infection and prevent new infections. Try at-home treatments, such as the following. /r/n/r/n Water helps flush harmful bacteria out of your system and may help the body fight an infection. Be sure to drink at least 8 glasses of water daily and include foods with a high water count, like watermelon, soup, oranges, and lettuce. /r/n/r/n Urinating when you feel the urge to pee or emptying your bladder every couple of hours is also recommended. This assists with flushing out the urinary tract system. /r/n/r/n Dmannose is a type of sugar found in some foods like cranberries and tomatoes. It's also available in supplement form. /r/n/r/n Studies are conflicting on whether Dmannose can treat or prevent UTIs. A study in 2022 found that Dmannose helps to prevent bacteria from adhering to the urinary tract lining. However, a 2024 randomized clinical trial of 598 women with recurring UTIs found no benefit of using Dmannose for preventing UTIs. As of now, there are no specific guidelines for taking Dmannose for UTIs. /r/n/r/n Scientific evidence on cranberry juice for UTI support is mixed. While unsweetened cranberry juice and cranberry pills have been shown to potentially decrease the risk of getting a UTI, more research is needed around precisely how long they need to be taken and in what amounts to achieve these positive effects. /r/n/r/n Probiotics encourage healthy bacteria in the digestive system. Studies have shown that these nutrients may prevent harmful bacteria in the urinary tract by adjusting the pH of your urine to make it an undesirable environment. /r/n/r/n Some foods may irritate your bladder and urinary tract, such as /r/n/r/n You can help reduce your symptoms by avoiding these foods while you're recovering from a UTI. /r/n/r/n When using the bathroom, the best way to prevent spreading even more harmful bacteria from the anus to the urethra is to wipe toilet paper from front to back instead of vice versa. This may be helpful when trying to clear an existing mild infection. /r/n/r/n Some studies suggest that certain oral contraceptives may increase the risk for UTIs, including unlubricated condoms, spermicides, and diaphragms. Check with a healthcare provider before changing any birth control or medication you're taking. /r/n/r/n This tactic is sometimes recommended in postmenopausal people with recurrent UTIs. Ask a healthcare provider whether vaginal estrogen in a cream, tablet, or ring may suit you. Vaginal estrogen can help increase good bacteria to prevent infection. /r/n/r/n In addition to using home remedies to support urinary tract health, experts suggest a couple of tactics for managing and alleviating painful UTI symptoms at home. These include /r/n/r/n While these strategies may help provide some relief, they aren't proven to treat the bacterial infection. /r/n/r/n If you've tried at-home remedies without success, seek medical attention. This is particularly important if you're experiencing any of the following symptoms, which may be a sign of a possible kidney infection or another health issue. /r/n/r/n Antibiotic treatment for UTIs can start clearing infections within a couple of days. /r/n/r/n Antibiotics are commonly used to cure UTIs. But for people with mild symptoms or uncomplicated infections, it may be appropriate to first try at-home remedies. /r/n/r/n Strategies to reduce the likelihood of infections or help them to improve include drinking more water, using vaginal estrogens, if you are past menopause, and urinating often to help flush the infection from your system. /r/n/r/n If nothing helps, consult with a healthcare provider about antibiotics and the safety of self-care practices in the future. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.